Welcome to this, our third day of our 2023 Global Partner Meeting. I'm Frances Reid, Director of Programmes for the World Ovarian Cancer Coalition, and today it's all about updates on the work that we are doing. In this first session, I'll be presenting information on two important studies we're currently undertaking, and then my colleague Phaedra Charlton will take over to let you know all about World Ovarian Cancer Day 2024. So I'm going to start with the Every Woman Study Low and Middle Income Edition. Hopefully you have heard about it before, but just to recap, it's a patient experience study. It's been run at the moment in low and middle income countries and builds on work we did in 2018. The areas of questioning we're looking at are about family history, routes to diagnosis, experience of treatments and the impact of treatments, emotional, practical and information needs, and women's priorities and quality of life. Now, I don't need to probably explain this to you, but I like repeating it very often, and that is, why is patient experience data so important? And that's because we often talk about issues around access to diagnostics, surgery and medicine, and those are key elements for getting good treatment for ovarian cancer. But there are issues around those that prevent women often from getting the best possible care. They're financial barriers, geographical barriers, cultural and gender norm barriers, and health literacy. So we know it's really important to try and enable countries to understand what is going on in their particular location so that they can advocate for the best changes that will make the largest impact. Why are we doing a low and middle income country edition? That's because actually 70% of women who have ovarian cancer in the world live in those settings. You can see here significant incidence and deaths from the disease, albeit that cervical cancer has a huge death toll in low and middle income countries as well, but this is now decreasing. Cases of ovarian cancer are set to rise hugely by 2040, an increase of nearly 40% in incidence and nearly 50% in mortality. But actually, it's the low and middle income countries that will bear the greatest burden. So, for example, in Africa, cases are expected to nearly double by 2040. Our Every Woman study in 2018 showcased the challenges that face women with ovarian cancer. We had women from 44 countries participate, but they were almost exclusively from high-income countries. So this meant there was a big data gap about women living in low and middle income countries. So it became an important part of the data management to unearth and uncover some good data about what was happening in these settings. We've been working for the last long time now, a couple of years, to build a network, and we've had 24 countries involved in the process, listed here, spread geographically and by income country. We've adapted our original survey to be administered in hospitals, and it's available in 31 languages, and women can participate by WhatsApp, by email. They can be interviewed in the clinic, or they can fill in a paper copy of the survey. So we're really opening up access to enable women to participate. As I said, it's all about patient experience. So I want to spend a couple of minutes just sharing a video produced by our partner organisation cancerbd.net in Bangladesh of Hafiza and her experience with ovarian cancer.
আমি হাফিজা, বয়স 24, আমার জেলা হচ্ছে টাঙ্গাইলের, গ্রাম হচ্ছে ভপুর। আমার এই রোগের প্রথম লক্ষণ হলো প্রথমে অনেক পেটে ব্যথা পাইতাম, পেট আস্তে আস্তে ফুলে যেত, খাবার দাবার হাঁটা চলা এগুলাতে ঘুম খুব অনীহা চলে আসতো। আমাদের ওই ডিস্ট্রিক্টে টাঙ্গাইলে সোনিয়া নার্সিং হসপিটালে প্রথম ডক্টর দেখাই। সেখানে আলট্রাসাউন্ডের মাধ্যমে ধরা পড়ে যে আমার ওভারি হয়েছে। অনেক ভোগান্তিতে ভুগতে হয়, ডক্টর দেখাইতে পারি নাই, তারপরে সিট পাই নাই। অবশেষে অনেক কষ্ট ক্লান্তি, অনেক 12 দিন বাসা ভাড়া থাকার পরে অবশেষে ডক্টর দেখাইছি। ডক্টর দেখানোর পরও তারপরে 4 দিন পরে বেড পাইছি। শনিবারে এসে ডক্টর দেখলো, কিন্তু তারা কিছু বললো না। তার 2-3 দিন পর ডক্টর আসলো, এসে দেখি যে আমার অনেকটা পেট ফুলে গেছে। আমি 2-3টা বালিশের মধ্যে শুইতাম, কিন্তু তবু আমার মুখ দেখা যেত না। হাঁটা চলা খাওয়া এগুলো কিছু করতে পারতাম না। আমার শরীরে যে একটা মাছি যে বসছে, তাও আমি সেটা দৌড়াতে পারি নাই। তারপরের দিন ডক্টর আয়েশা পাইপ দিয়ে 7 কেজি পানি বের করছিল। পানি বের করার পরের দিন তারপরে আবার কিমো দেওয়া হয়েছিল। কিমো দেওয়ার পরে তারপর আল্লাহর রহমতে আস্তে আস্তে যখন ভালো একটা সুস্থতার মধ্যে আসছি। শুরুতেই আমি প্রথমে বুঝতে পারতাম না যে এত বড় একটা রোগে আক্রান্ত হয়েছি। ভাবতাম যে গ্যাস হয়েছে, তার জন্য এরকম পেট ফুলে যায়, পেটে ব্যথা পায়, সেটা ভাবতাম। এর জন্য আমি অন্য ওষুধ খাইতাম বা ভালো কোনো বিশেষজ্ঞ ডক্টর দেখাই নাই। যখন টেস্টগুলো করা হলো, তখন তার মাধ্যমে জানতে পারলাম যে এই রোগটা হয়েছে।
Thank you to cancerbd.net for that very moving video. So where are we now with the study? Well, there have been many meetings, oversight committee meetings, meetings with country teams, and so on. But we have made really important progress. 22 countries have got ethical approval to run the study. Over 2,000 women have now participated. Data collection is coming to an end at the end of December. Some countries have already stopped, some are only just starting, so we're racing to get their entries in as soon as we can. I'm beginning to work on the data cleaning country by country and then producing their draft country reports. So we ask them to get a minimum sample of women, and this is so that we can produce a report country by country that lists their results, that allows them to state with some confidence on issues that are important in their country. So we're working on those already. When we've cleaned all the data, we will pull the data and look at it in terms of the global context, and then be able to provide information as to how countries differ, because that's what we found in our first study. There was a common set of problems that face women, but the extent to which each of those problems was an issue by country varied. We can all learn from each other. So I'm going to show you a little bit of sample data. It's taken from when we had just under 1,800 women. It's unpublished data. Please do not use it, but it'll just show you a flavour of the type of things we're beginning to see or that we can look at. So the most common types of ovarian cancer. Now here you'll see already, just looking at the multitude of different coloured bars, they vary by country and they vary quite significantly. So for example, in Mexico, there's very high rates of high-grade serous ovarian cancer. Some countries are unable to specify which type of ovarian cancer they have. Countries such as Kenya is experiencing high rates of granulosa tumour. All these things will impact on women's experience and on their overall results. So it's going to be really important to take this into account. Looking at the stage on diagnosis, this is a pretty familiar type graph actually, in terms of the proportion of women diagnosed with stage 1 or stage 2 disease, so it's about a third, versus women diagnosed with later stage disease, around 2/3. But again, that's varying quite significantly. Malaysia having a high proportion of early stage diagnosis, Mexico having a very low stage of diagnosis, early stage diagnosis. No doubt influenced by the type of ovarian cancer, but there will be other factors at play as well. An example, we've looked at how many women have received surgery and the extent to which they've had maximal cytoreduction. And again, it varies by country. This is not unsurprising to us, but it's going to be important to quantify. Just a quick flavour of our demographics and the type that we can look at. Here you can see big variations in the proportion of women who live more than 2 hours away from their hospital, which adds extra time, cost onto their burden in terms of getting treatment for ovarian cancer. So here Bangladesh and Kenya in particular have a big burden. Here we look at the proportion of women who have only been educated to primary school level or had no formal education. So we have a really wide range of demographics in the group. It's not just educated women who are participating. And we've also looked at household income, and these are the proportion where they claim their household income is below average for their country. Again, Kenya, Bangladesh and Mexico here have very high rates of poorer women. We're seeing at the moment that 62% were employed at the time of diagnosis. This is of all the women involved. We've looked at have they ever heard of ovarian cancer, and again that varies by country, and this will be really important in determining whether countries invest in raising awareness and so forth. We've looked at their route to diagnosis. In Kenya, for example, what we've discovered is that quite a large proportion of women don't go to a general practitioner or a gynecologist, but they go to what they call an alternative health practitioner who isn't as qualified as those other practitioners, and we're looking at how that might impact, for example, on routes to diagnosis. And we've looked at how family finances are affected by a diagnosis and the treatment of ovarian cancer, and it is hugely burdensome in many of the low and middle income countries, to the extent that quite a lot of families don't have the resource that they need to live on. Couple of sample stories here. On the right hand side you can see 24-month delay in seeking help due to financial constraints, a 13-month patient delay, and then a 1-month delay for this lady in the middle, a 4-month patient delay, a 1-month doctor delay, and a 24-month treatment delay due to financial issues here. These are some of the really difficult problems facing patients around the world. These are their average times to diagnosis, again, at the moment. As I said before, this is unpublished data, so please do not use it. Those results for Kenya have inspired our country lead in Kenya to list her priorities, and they are about improving levels of awareness and health-seeking behaviour, that women should seek out help from doctors and hospitals. Also, the importance of educating primary care workers about symptoms and the need for investigation. They're already beginning to work on improving support for women with ovarian cancer in their hospitals, and they are keen to advocate for diagnostics and treatments to be covered more widely by health insurance to reduce the financial burden. So there may be changes beginning to happen already on the ground, even though the study isn't finished as yet. We've also been having a scientific impact, some publications already, more publications underway, as it were. So, and we expect to reveal the full results next year, towards the end of 2024. But it's not just scientific impact in terms of journals. Our country leads have been very active in terms of spreading the word about the study. For example, the Gynecological Oncology Society of Nigeria, Aortic, has held a webinar on the study. South African Medical Research Council, a research centre here in Cape Town, have presented on the study. This is an Argentinian conference here talking about the study, Kazakh conference talking about the study in a regional event, and Malaysian gynecologists talking about the study. So it's generating a lot of interest around the world in the clinical community at present. Recently, of course, we were at the International Gynecological Cancer Society meeting in Seoul, and we were honoured to be given an hour-and-a-half slot to present on the study and discuss the issues facing the teams and the priorities that are beginning to emerge for them. And this is them pictured here. And we are also beginning to see the impact on advocacy, which is really important. It's not just about what the study finds, it's about what happens next. So we've had Media Day in Bangladesh. Our country leads have got active promoting things on Twitter. We've participated in London Global Cancer Week. Ovarian Cancer Malaysia has been formed. And for example, in Nigeria, we now have the support of the First Ladies Against Cancer, the Medicaid Cancer Foundation, and the newly formed National Institute for Cancer Research and Treatment. And we're working with them at bringing together key stakeholders next year to discuss the findings. None of this is possible without our brilliant oversight committee, which include members of our board, partner members representing patients, and our country leads, who have done an amazing job getting this up and running, and we really look forward to bringing you more results in the future. So now I'm going to tell you a little bit about our next study, which is the cost of illness study. Now, the rationale behind this is to generate data on the cost of ovarian cancer to healthcare systems, including the cost of treatment at different stages of the disease and the amount that could be saved if we improve the time to diagnosis to enable earlier treatment of the disease. We're looking here at all income settings, high, middle, and low income countries. And this will be the first global ovarian cancer cost of illness study conducted. The literature on cost of ovarian cancer is very limited, and it will strengthen the case to make ovarian cancer a policy and public health priority. We will also look at the contribution that women currently make to society and that the impact that a diagnosis of ovarian cancer has on this, so that governments and societies understand what the true impact is on the wider economy. And we also hope it will provide advocacy organisations with original and impactful evidence relating to the cost of ovarian cancer to their healthcare systems and economies. This isn't something we could do on our own, so we've been very fortunate to secure the services of RTI International and their Centre for Global Non-Communicable Diseases. They are conducting the study for us in 11 countries listed here: Australia, Canada, Colombia, India, Kazakhstan, Kenya, Malaysia, Mozambique, Nigeria, UK, and US, to estimate the health, economic and social burden of ovarian cancer. Now, RTI have a long track record in this area and have produced many cost of illness studies and subsequent publications as well. So the costs they'll be looking at in the analysis of the burden of ovarian cancer will be the direct costs of cancer, the healthcare expenditures attributable to ovarian cancer care across the care continuum. We'll also look at the indirect cost, the productivity loss. So the fact that women can no longer work, that they're absent from work, that perhaps even if they return to work, they may not be able to work at the level they previously did, and what it leads to in terms of employment shortfall in people living with ovarian cancer and cancer survivors, ovarian cancer survivors. And we will also look at the indirect costs involved. So trying to put a sort of monetary value on the time that informal caregivers spend providing practical support to people, to women living with ovarian cancer. And we know that is significant. So it's going to be a really wholesome study, we hope, providing a lot of interest and material across the different income settings. So our next steps are to incorporate feedback. So our ovarian cancer expert group have already looked at the proposals and have fed back, We're also feeding in some data from the Every Woman Study Low and Middle Income edition, and from the Canadian version of the study, and from our 2018 version of the study. So work at the moment is going on to refine and present the costings framework, and then this will all be finalised in January 2024, and then we will look to be writing up manuscript aiming for publication later on next year. And alongside these, we will be developing a series of patient stories that tie into this, and both the Every Woman study as well. So hopefully a very rich vein of information coming next year. And we will launch it fully at UICC and IGCS around the time of publication. That's all from me. I hope you find that interesting and we'll look forward to it. But before then, next year, we have, of course, World Ovarian Cancer Day 2024 to look forward to. And to give you an update on plans for that, I'm going to hand over to my colleague, Phaedra Charlton, who is our Director of Communications. Thank you very much.
Thank you, Frances. As she mentioned, my name is Phaedra Charlton, and I am the Director of Communications and Marketing for the World Ovarian Cancer Coalition. And it is my pleasure today to be talking to you about World Ovarian Cancer Day 2024 and our general awareness activities next year. Before we dive into 2024, though, just to give a quick update or recap of last year, which was, by every stretch of the imagination, a banner year, and we could not thank you enough. It really is because of you, all of our partners, that we were able to reach almost 200 million people. In fact, when you look at the extended campaign period right through to June 4th, there was a huge ripple effect, and that number was well over 210 million. So our reach was well over 600% over 2022. So really, with your help, we are that much closer to no woman left behind and no person left behind. As you can see, we had almost 900,000 interactions, social likes, thousands of tweets. Our Get Involved guide was downloaded thousands of times. And our new social media frame that we launched last year was used 1,500 times. So really, really astounding figures. And again, it's all down to you. So top 10 countries and languages, some of the usual suspects here, but we're really excited to see some of the countries that are involved in our Every Woman Study Low and Middle Income edition making the top 10. We're looking forward to this year when we release the results of the study, and looking forward to working with advocates in those countries to even bring up the engagement even more. Speaking of engagement, well above benchmarks, the gray line that you see there, that's the kind of industry standard benchmark that if you hit that, you're considered to be doing very well. As you can see, we passed that by a long chalk on all fronts, but especially on Facebook, almost 600% reach and engagement over 2022.
Our followers have gone up. And as you'll see, our demographic is well within the female from 25 to 54. That's where the core our demographic is, which isn't surprising as that is our target market. This year was the first year of our ambassador program, and we were honored to have Their Excellencies Dr. Zainab Shinkafi Bugudu from Nigeria and Dorothy Nyong'o from Kenya, who are two First Ladies of Africa, as well as New York Times bestselling author Deborah Harkness. We're actually looking at expanding this program in 2024 and beyond. So if you have any ideas of potential ambassadors, we would love to hear from you. We were also fortunate enough to have many influencers help us out on the day, including our own Robin Cohen, who was on the Drew Barrymore show. We had an Olympian. We had lots of social media posts from around the world. But I guess one of the most influential was certainly Angelina Jolie's post on Instagram. So now looking ahead to World Ovarian Cancer Day 2024. So what's new for 2024? Well, I'm sure you've heard the expression, if it ain't broke, don't fix it. So we are sticking with the No Woman Left Behind theme, but we will be making some slight adjustments to our artwork to reflect the current trends in social media. The current trend for social now is to have the posts in portrait format, so we will be updating all of our artwork to match this latest trend. However, much of the content will remain the same. And here's just a sampling of what some of the other posts will look like as we head into our 12th World Ovarian Cancer Day. And of course, we will have translations. Thanks to the help of volunteers and many of you at our partner organizations, we're now up to 50 different languages, but we still are missing some. This is just a partial list of the languages we're missing, and if you are interested in helping us, we would love to hear from you. We will also be bringing back our popular social media frame that we created on Canva for last year. We're also going to be investigating different templates that we can use on Canva, and there'll be more news about that as we get closer to World Ovarian Cancer Day. So here's a brief timeline of what's happening for World Ovarian Cancer Day 2024. Save-to-date posts in various languages and formats will be available January 1st. As in past years, the campaign soft launch will begin on World Cancer Day, which is February 4th. And then just in time for International Women's Day on March 8th, all of our translated posts and tools will be available for you to use, including our how-to guide and our social media calendar. So World Ovarian Cancer Day just covers one part of the year, but we want to raise awareness year-round. So this year we will be continuing our No Person Left Behind campaign, and this will be the third year of our LGBTIQ+ campaign, and this is in June. In September, we will also build upon last year where we actively engaged with Gynecological Cancer Awareness Month and World Go Day. And we are also starting a new series called Inspiring Voices, and this will involve release of videos in the second half of 2024. So what is Inspiring Voices? As I said, this is new for next year, and we're looking for personal stories that we'll capture during video interviews, focusing on individuals or communities that are known to experience healthcare disparities, and that's in the first instance. We'll also be wanting to capture all sorts of stories from all over the world. And the desired impact is empowerment, education, awareness, and also to address stigmas. Because sadly there is still a lot of stigma and shame around an ovarian cancer diagnosis in some communities, stories can be anonymous, or we can alter the voice for disguise. The stories also can be told in a native language. It doesn't necessarily have to be in English. It can be in any language that the person is most comfortable in speaking. And we can also capture it in media other than video. Although video will always be our first choice to give us the most flexibility, we understand that not everyone will feel comfortable giving their story in a video chat. So we can capture it on audio only. We can capture it through a series of email exchanges or WhatsApp interviews, whatever is most comfortable for the person sharing their story. So if you have any potential candidates for this Inspiring Voices series, please do get in touch. You can reach us at voices@worldovariancancercoalition.org, or you can scan the QR code here just to the right. So that's it from me and my colleague Frances at this coalition update session. Please join us at 3 p.m. UTC for Mikis Euripides, who will be interviewing 3 leading clinicians on the latest in ovarian cancer developments this past year. And a huge thank you to our sponsors, without whom this event would not be possible. If you want more information on the coalition, you can visit our website, or you can scan the QR code here on the right. Thank you very much, and we'll see you soon.